Thank you for your participation in this webinar. Kindly requesting all participants who just joined us today to please fill in the pre-event survey using the QR code shown on the screen. And if you can scan it, you can click the link as posted on the chat box. There will also be a post-event survey for you to fill in towards the end of the forum. Inshallah, the event will start approximately at 9 a.m. So please stay tuned with us.
Merah gitu. Merah. Boleh sekejap bar. Testing. Have we tried?
Ladies and gentlemen, please be informed that the webinar event will start in approximately 5 minutes. Please get yourself ready for the forum. Please be reminded that you can keep your camera and microphone off for now. Regardless, be prepared to as well to open the camera later for a group photo session after the recital of Dua. Thank you for your patience. Yeah. Did you close the camera? Oh. See everybody close the camera. Morning, Ramsey. You are mute.
Alaikum Yasir.
Alaikum salam wa rahmatullahi wa barakatuh. How are you?
I'm good, alhamdulillah. How about you?
Alhamdulillah Rabbil Alameen.
You switch off your camera. Okay.
Yeah, oh, we didn't know because internet. We need to.
Buat pasuk sekali lagi tu, lo kena.
Check your computer. The camera is already stopped. Let me ask Ramsey. Ramsey, you see me?
Yes, yes. Very
Yeah.
clear. Yes.
Thank you.
No problem.
Good morning, Jimmy.
Jamie. Morning, Jamie.
Yes, good morning. Good morning, Yasser. Good morning.
Morning.
Assalamualaikum Yasir.
Alaikum salam, Viji. How are you?
Alhamdulillah. Ramadan Kareem.
Allah Akram.
This is the last 10 days
Yeah,
yeah, of Ramadan.
yeah, yeah.
Hey Jamie, morning Jamie.
You are mute.
You're muted, Jamie.
I said looking forward to active participation by everyone. Thank you.
Yeah, sure, no problem.
Good morning, Jamie.
Good morning. Thank you for joining us.
Thank you. I see we get a full program of different speakers. Yeah, we look forward to hearing that.
Yes, yes.
Hi, Zahar.
Hi, Terry. Thank you for
Good
joining
morning.
us.
Yeah,
Morning.
I try to share that with as many people as we can. Hopefully, they are able to, come in.
We see something that is not relevant, let me know that.
I know why we don't have a camera.
Bismillahirrahmanirrahim. Distinguished guests, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh and a very good morning. Welcome to the first session of the Safety, Health and Environment National Authority (SHINA) webinar in the conjunction with the World Day for Safety and Health at Work of 2022. Kindly seek everyone's attention on the screen now for the agenda of today's session. For today's webinar, we are glad to have representatives from various workplaces and industries in Brunei Darussalam to present and share some thoughts on the theme for the World Day for the Safety and Health at Work this year, which is to act together to build a positive safety and health culture. First of all, to bless today's event and seek protection from the COVID-19 pandemic, we would like to invite Yang Mulia Tuan Mas Nadi bin Haji Masri for the recital of Al-Fatiha and dua protection from the COVID-19.
استغفر الله العظيم استغفر الله العظيم الذي لا اله الا هو الحي القيوم واتوب اليه دارة النبي المصطفى رسول الله صلى الله عليه وسلم وآله وأصحابه الكرام الفاتحة أعوذ بالله من الشيطان الرجيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين آمين آمين بسم الله الرحمن الرحيم الحمد لله رب العالمين والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين لا إله إلا أنت سبحانك إني كنت من الظالمين لا إله إلا أنت سبحانك إني كنت من الظالمين لا إله إلا أنت سبحانك إني كنت من الظالمين نعوذ بكلمات الله التامات من شر ما خلق نعوذ بكلمات الله التامات من شر ما خلق نعوذ بكلمات الله التامات من شر ما خلق بسم الله الذي لا يضره مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم بسم الله الذي لا يضره مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم بسم الله الذي لا يضره مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم بسم الله والحمد لله محمد رسول الله لا قوة إلا بالله بسم الله على ديننا وأنفسنا بسم الله على أهلنا وأموالنا بسم الله على كل شيء أخطأنا ربنا بسم الله خير الأسماء بسم الله رب الأرض والسماء بسم الله الذي لا يضره مع اسمه داء بسم الله افتتحنا وبالله اختتمنا وعلى الله توكلنا تحصنا بذي العزة والجبروت واعتصمنا برب الملكوت وتوكلنا على الذي لا يموت اللهم إنا نعوذ بك من البرص والجنون والجزام ومن سيء الأسقام اللهم اصرف عنا وعن سلطاننا وبلادنا وجميع المسلمين في كل مكان البلاء والوباء والطعن والطاعون وسائر الأمراض وخصوصا وباء COVID-19 وكنا شر الردى بلطفك يا لطيف يا خبير إنك على كل شيء قدير وصلى الله على سيدنا محمد وعلى آله وصحبه وسلم والحمد لله رب العالمين.
Amin, 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 ya Rabbal Alamin. Let's hope today's forum today will run smoothly as according to the plan. Ladies and gentlemen, before we begin, we kindly request everyone to switch on your camera so we can try to take a group photo.
Wait, Shida, can you say like 1, 2, 3 before you take the picture? Thank you.
Okay, everyone, get ready. Okay.
All right, thank you, everyone.
Thank you everyone for opening up your video. So you may switch off now your camera. Thank you. Ladies and gentlemen, before we start with the presentation, we'd like to remind all participants of the general guidelines during the event. Please keep your cameras and microphone off throughout the presentation to reduce the bandwidth use and to minimize the noise and background echo. If you have any questions throughout the presentation, throughout the webinar, please use the chat box features, which can be found at the top right-hand corner of your screen. Question will be addressed at the end of the presentation session by our moderator later on. Questions that are not addressed due to time limitation will be answered offline and will be uploaded to the Shina website at www.shina.gov.bn after the event. We also will give an opportunities for the audience to ask questions as well verbally. So you can raise your hand using the raise hand button during the question and answer session later on during the moderation session. Yeah. Please be informed that this event is being recorded as well and will be shared on the Shina website for public access, along with the presentation slides used today. Should you have any technical difficulties, please feel free to reach out directly and inform us in the chat box, and our technical team will assist you. Ladies and gentlemen, the World Day for the Safety and Health at Work is commemorated every year on the 28th of April. As mentioned earlier, the theme for the World Day for the Safety and Health at Work of this year is Act Together to Build a Positive Safety and Health Culture. Throughout the COVID-19 pandemic, we have seen that having a strong occupational safety and health system, which includes meaningful participation of governments, employers, workers, public health actors, and all the relevant parties at the national and enterprise level, which has been crucial in protecting working environments and safeguarding of the safety and health of the workers. To start our today's webinar, may we first invite Yang Mulia, Captain Jamie Rebello, the Head of Enforcement Division for the Safety, Health and Environment National Authority Shina, for the opening remarks for today's webinar and the short presentation on the topic of the safety and health culture. Please welcome Tuan Jamie.
Distinguished guests, ladies and gentlemen, and to all of you who have joined us online today, a very good and safe day to all of you. I would like to take this opportunity to thank all distinguished guest speakers from Brunei Fertilizer Industries, Brunei Methanol Company, Unified National Networks, SWE, Print Plus, and SBHI Foods for their support and involvement with this important event, and would also like to thank the organizing committee for their efforts in putting this event together. And to all of you who have joined us online, thank you, and I hope to have your active involvement with the proceedings. It is my honor and privilege to raise your attention to the fact that this year, the World Day for Safety and Health at Work 2022 will target the most important topic of participation and social dialogue in creating a positive safety and health culture. And for all of us in Brunei Darussalam, this is even more relevant as we embark towards the new normal of living and working in the aftermath of the COVID-19 pandemic. Next slide, please. A little introduction and context would be needed as to why this topic has relevance and is of grave importance to all of us. As clarified by the International Labour Organization, ILO, last month, over 1.9 million people have died, and an estimated 90 million disability-adjusted life years have been attributed to the exposure to 19 major occupational risk factors. Furthermore, some 360 million non-fatal occupational accidents occur each year, resulting in a loss of 4 man-days from work globally. This is in itself significant, and the need for ownership and commitment from all work stakeholders within the government, industry, and all those who have reason to be at work. Next slide, please. We are all aware that the impacts of the COVID-19 pandemic in Brunei has been significant. However, what is more relevant and of significance is the levels of collaboration, partnership, and engagement between government, the regulators, and industry stakeholders coming together for the common goal to prevent the spread of the virus and to safeguard the lives of those at work. This has been an opportunity to build on poor work practices and to review existing legacy procedures and realize that we must nurture the environment around us and create a safe workplace for the safety and health of workers. This is a time to call for a review of your work practices and to face the occupational safety and health challenges together for the common good of all those around us. Next slide, please. ILO has provided us with some statistics that crucially draw our attention to the impacts of our work activities, especially the occupational risk factors that present themselves when dealing with asbestos, hazardous gases, particulate matter, as well as the impacts from exposure to occupational injuries and long work hours. These are not necessarily related to the long hours spent at work each day alone, but also have a major impact when it is related to mental health for those who continue to work without breaks and the ability to have a suitable work-life balance. This is seen as the highest contributor globally to occupational deaths. Next slide, please. So what can we do? It is time to stand together. A joint effort is needed from all stakeholders focused on creating a better tomorrow by monitoring and managing the safety and health of all workers. Time to increase efforts to promoting a safer and healthier workplace. And this can only be achieved by the joint efforts of employers and employees, a single-minded approach to ensuring that we work to improve the responses for occupational health services, not only within our working environment, but also our communities. Employers must find ways to develop suitable and relevant policies and implement programs that will engage employees and provide the assurances that are required to prevent more fatalities and reduce harm to persons within the workplace. Next slide, please. Not a good picture, and we must pay heed that if we do not work together and do not collaborate to raise HSE awareness across the country and within every workplace, we will be unable as a working population to ensure the aspirations of Wawasan 2035 and the safety and well-being of our workforce. 68 work-related fatalities over the past 9 years. How can you help to prevent the next one? How can you ensure that your brother, sister, family member, or friend goes home safely to his or her loved ones? Next slide, please. I have once again shared this slide as a reminder that we have yet to show the necessary improvements required. Lives matter, and it is up to each one of us to make a difference and prevent this statistic from growing any further. Today, you are called to step up and be the difference not only within your workplace, but also within the community, spreading the message that by ensuring safer work practices, we can and we will ensure a vision of a safer tomorrow for future generations. Next slide, please. The Ministry of Health has provided us statistics for workplace accidents in Brunei. And here we can see that the major contribution comes from work-related accidents in the construction sector, followed by manufacturing and the wholesale or retail trade sector. Though the numbers are marginally better in 2021, this could also be attributed to a lack of reporting by those concerned. Next slide, please. On this slide, we have the opportunity to relate with occupational and work-related diseases recorded by MOH in Brunei, where the 2021 statistics show us that occupational dermatitis is reported to be the main contributor. Should we not be worried and concerned with all the construction and hydrocarbon activities occurring around us that has the potential of causing long-term health impacts to the workforce involved by ensuring good practices and reducing emissions, as well as preventing dust pollution within the construction sites and workshops, and by putting in place good practices and healthcare monitoring, there is an opportunity to reduce the long-term effects of occupational diseases in the years to come. Next slide, please. So what will it take to improve the HSE culture within your working environment? We need the full commitment of top management, as well as the workforce, working together to build a safety culture, having competent HSE supervisors on site, providing for an environment that allows for training and the provision of information to the workers, risk assessing and managing hazards on site, creating and maintaining a just reporting culture, allowing for a level of reasonability and flexibility in the face of adversity, being prepared for and anticipating times of crisis, having a level of tolerance to those who make mistakes and learning from our mistakes, being organized, and always working as a team are some of the many factors that contribute to bringing about the change that will ensure better standards and improved business performance. A resilient attitude will ensure that in the end, the mind that is one that benefits all those around and the environment. Next slide, please. We have the opportunity in front of us. It is about today and now. Don't wait for the next calamity or crisis to realize the change that is needed. It is about felt leadership by all our leaders, being committed to work and walk the talk and set the right example for those around us, anticipating the risks and collaboration with our stakeholders, knowing that such actions will ensure we will together create an environment that benefits occupational health awareness with the support of our medical practitioners and good policies for the safety and health of workers. Raising of HSE standards has always been beneficial for business, and even today there is adequate evidence that more capable and competent workers provide for the necessary efficiencies on site. Timely completion of projects can only be evident when we work together, building human capital and raising OSH competences within the workforce. This is the time for reinforcing effective collaboration and spreading the right message that HSE matters to you and to me. Next slide, please. As a final summary, I would like to provide you with a few key considerations in closing. It is about compliance to legislation and good industry practices, whilst always ensuring the right resources are in place. Integration of occupational safety and health management systems within your work activities is the key to your success. It will always be about making OSH values the top priority and commitment within the sphere of your influence through open dialogue, reviewing and improvement of work practices that ensure minimizing cost and impact, building the trust not only within the organization, but also with your partners and collaborators. Through positive and authentic leadership practices, we pave the way for our success and the success of the organization as a unified front, ensuring a safer workplace, providing for a learning organization that will always ensure the right practices provide for seamless integration and a responsible approach by all that allows future generations to enjoy the fruits of our commitment and actions within the country. Be prepared to adapt and remember that you remain responsible for your actions. Thank you.
Thank you very much, Captain Jamie, for the opening remarks and as well to create the scene of today's webinar. Without further ado, we would like now to invite representative from the telecommunication industry. We have the Unified National Network, UNN. We are glad to have our invited speaker this morning, Yang Mulia Awang Muhammad Zaini bin Awang Junidi, HSE officer for the UNN, who will share some thought on building a positive safety and health culture in the perspective of telecommunication industry. So please welcome Tuan Zaini.
Thank you, Tuan Zahar. Assalamualaikum and good morning, everyone. My name is Zaini Junidi, representative from Unified National Network, or better known as UNN. Next slide, please. In this session, I will provide an overview on how UNN manages safety and health culture, initiatives and programs that UNN has carried out, and sharing on UNN COVID-19 de-escalation plan. Next slide, please. UNN, a fairly new and young company, is established due to the needs to consolidate all network infrastructure, which was previously operated by telecommunication service providers. Different organization or company will have their own HSE cultures. Hence, when the previous service providers are merged into one management, there is a conflict in cultures. This includes HSE. The challenges here lies in the harmonization and reintroduction of safety HSE culture, the UNN way. These include providing streamlined knowledge and information on HSE, alignment on domain processes and procedures to include HSE aspect. And since UNN is in the telecommunication industry and support the digitalization of Brunei, we aim to digitalize our HSE system and utilize the technology that we have to carry out HSE function. There are many ways to overcome these challenges. However, we summarize it into just a simple 3 C's. The first C, communication, is where information is communicated across the organization from top to bottom. Second one is collaboration, teamwork between colleagues and looking after one another to ensure positive HSE culture in the organization. And lastly, the continuous improvement. We ensure our system, our processes, and our procedures are periodically reviewed to ensure consistency and relevancy on the current situation and practices. Next slide, please. UNN has carried out several initiatives and programs to promote HSE culture. On the awareness side, we have carried out HSE induction, especially for new joiners who joins UNN, and as well as for our contractors who are working with or for UNN. We also provide in-house trainings, some example including our PTW system, our HSE reward system, and as well as incident reporting. We consolidate any HSE related topics into our HSE bulletins, which are published monthly and comes in both English and Malay language. Site visits are also being carried out to ensure safe practices and best are being implemented and practiced at the workplace. UNN also organized UNN Safety Day, as this is one of the ways to promote HSE in the organizations. In terms of COVID management, we provide routine update to the staff on the COVID situation, and as well as we track our staff vaccination status and also those who are being red-coded or being tested positive. UNN also provide COVID-19 essential items such as ART kits, hand sanitizers, as well as face masks. And we also deliver care packages to staff who are being treated as positive. UNN also provide a special leave where staff can utilize to take care of their household member or family member who are tested positive COVID-19. Weekly ART tests are also introduced for both staff and contractors. And UNN has implemented COVID-19 de-escalation plan to work back in the office, which we will have a look later on. In terms of mental health, as mental health has been discussed quite a lot, and this has become more apparent when staff are working from home. So we have organized quite a few talks on this one, and the topics are including COVID-19, how to cope with COVID-19, awareness on mental health and mental illnesses, how to manage stress, achieving work-life balance, and conflict management. UNN also provides support to staff who wants to seek professional help on their mental health conditions. Last but not least, UNN also take care of the staff welfare. Hence, we provide flexible working arrangement. A healthy lifestyle are also carried out by having sports and recreational activities. And during the COVID-19 situation, we carry out virtual exercises and as well as virtual healthy cooking sessions for staff. Next slide, please. Now, most of UNN staff has been working from home since the start of second wave of COVID-19 in August 2021. As such, UNN has developed and implemented the de-escalation plan to return back to the office, which to also ensure that our safety and health are prioritized. So this de-escalation plan can come in 3 phases. In phase 1, 25% of the workforce will return to the office. And we created a work bubble concept where staff from different work bubbles are not allowed to physically interact or enter the location of another work bubbles. Visitors who wish to enter UNN premises will need to seek permission from UNN COVID Committee, and once granted, they will need to carry out ART tests on the day of visit. In phase 2, 50% of the workforce will return to the office. And previous measure from phase 1 remain the same, they remain effective. with the addition that staff that are working in the office will need to carry out weekly ART tests. In phase 3, this is where 100% of the workforce will come back to the office. Staff from different work bubbles can now interact physically and enter the location of another work bubbles. Staff, however, will still need to be carried out weekly ART tests, and visitors, they are no longer need to require to seek permission. However, they still need to carry out ART tests on the day of visits. All these measures are in addition to the current SOP and guidelines that have been published by relevant authorities. Next slide, please. Moving forward, UNN as a young company, we will continuously review our processes, our procedures, our system, and we will improve on our HSC culture to ensure that it is relevant to the current situation and it can provide the effective safeguard to the safety of personnel and everyone around us. Thank you.
Thank you very much, Tuan Zaini. Certainly a big profile from the UNN side with a total of 700 staff nationwide. We are glad to see how UNN has taken the approach to manage the staff, especially on the management of mental health, which is certainly an obvious issue worldwide as a result of the pandemic COVID-19. Thank you again, Tuan Zaini. Ladies and gentlemen, from the telecommunication industry, now let's move our attention to the manufacturing industry. So we are glad to have two speakers from Brunei fertilizer industry, BFI Sdn Bhd, Yang Mulia Tuan Yasir Muhammad, Chief HSC Officer, and Yang Mulia Tuan Dudi Octoberlian, Senior Safety Officer, who will also present on how the organization ensure positive safety and health culture. Please welcome.
Assalamu alaikum and a very good morning to everybody. And I would like to thank Sheena for allowing us to share this presentation, how to build a good safety culture in your organization. I will share this presentation myself and my colleague Dudi. Next slide. Next slide. Yeah, next. Yeah. So next slide. Now, so definition of what is safety culture. Now, we can say it is a product of individual and group values, attitude, perception, and also I can say safety culture is how to value people, also how to share your people. For all of people have perception. What I mean that sharing of the people have to feel that all is work together. Safety is all of us responsibilities, not only management or not only HCT. Yes. Next. Thanks. Yeah, next, please. Yeah. Like Mr. Jimmy explained that visible management or management commitment is considers core items to improve your safety culture in your organization. At the beginning, to build a safety culture, you need to build a safe work environment. Safe work environment, which means that you have, if you are in the industry, you need to have a proper design, proper safety management system in place. Proper control of all the risk in the place before you start, and during your work, you have to manage any change via process like MOC. You have to have process hazard analysis in place, process safety analysis in place, all of this to create a safe work environment in your place. And even in the, I can say in construction work, you need to provide the proper tools, equipment, build a good scaffold, provide the workers proper PPE. If you have a workshop as example, workshop also, you need to have a proper workshop this workshop. If I work in any workshop and I come in every morning, I have a bad housekeeping, I have an oil leak, have not proper equipment, something like that. All of this is against safety culture. So what I mean is that at the beginning, you need to have a proper design, proper system, all the requirement, policies and procedure. Also, you need to have it in place. Policy is very important. The policy is considered the agreement between the organization and employee. All the organization in any policy, they put that okay, company commitment, company commitment and employees commitment. Like if I said employees commitment,
it will make a
Yeah.
sound.
somebody
Then
need
after
to
that-
mute, please.
That is the sign.
Yeah, okay. So as example, like I said, policy is both party commitment. If I say training, we should attend the training, this, and organization did not provide the training. So this is the issue. You said you commit by using a proper PPE, but quality of PPE is not good. You did not provide. All of this, like I said, when you put a policy, it should be commitment from both parties. And the people should feel that you are care. You are care about your people. So this is, you need to sell safety to your people. You need to, all of them to commit, to feel that the safety that it is both party. Build trust and reward scheme for your people and also celebration. So you need to build trust. Build trust, it means that every employee should be a team player. Start to trust. Many people have a concern that they said if we enforcing safety and make report of safety, it means that he is spying in his colleague or co-worker, which is not good actually. So all the staff or employees should know that reporting a safety violation incident will not lead to any bad action or something like that. You need to build the trust and to build a well-performing safety program. Also, a reward if your staff. If you have employees that go out of their way to enforce safety culture, they should recognize by enforcing a positive behavior, and it will lead to more employees to volunteer and to contribute your safety plan. Celebration of success. As example, all of us, when you achieve X million man hour, whatever, without lost time accident, you need to have some event, you need to award your people, you need to give something to the people that he can share also with the family. So he will feel that when he works safely, result, he need to feel the result, not only the number, company put in the number, we achieved 5 million. What means also we need to celebrate all of this event within your people. Competency and information. Actually, after you build, like I said, you have a good safety management system in place, design review, everything in place, but also you need to build your competency and training and information for your people. Sometimes you have, like, let me give a simple example. Someone, he work at height and he fall down or have an accident. You have to ensure that you give him a proper training and he's a competent to do the job. I still remember for many years ago, I have one banksman, he stand behind the crane in unsafe position. When I investigate, I find the person, actually he's not aware about his job. So this is the issue. We have to give the competency, the right training for your people, and don't give up. Always give the training, always share information. Always ensure your people are competent. Don't always try to put a finger against your people. Build from up to down. This is very important. So these issues, like we said, management responsibility and all the manager, all of this build from up to down, like safety culture should start from top to down. It is up to senior management to encourage safety program, like also walk the walk. And when it comes to enforcing policies, sometimes in Bilwi, they notice or that management gave instruction, gave advice, but sometimes they did not follow this advice. This one, it kills the safety culture in your organization. Top position in our company or in your company need to be 100% on board with promoting safety in your organization. Top down and hold the people accountability or accountable. This is very important. It should be, you have a process in place that hold the people accountable for safety violation, but also reward them when they are involving and for something good like promoting a safety culture, especially supervisors and the team leaders and the manager. So you have to make balance, not only to say, you are responsible about this violation, you are responsible, but you need also to award the people also when they have something good. There should be also be reminded that if someone have a violation, because you do not like to be a habit, it's a plant, or people that I can say still a risk how to continue is we can say what is the risk? Risk it would be as a normalized of the risk. So when people do something unsafe or something like that, you need also to have a discussion with them. Sometimes, but this is the last. You have to do disciplinary. But disciplinary after you give information, give training, talk to the person 1 time, 2 times, something like that. Reporting of incident and accident. This one is very important actually, because the accurate report of any accident is success of your safety program. Sometimes many of the organization, they, I can say, or any people, they are worried to report the accident because they are worried about the penalty if they report this accident. This actually increases the dangers of the company because unreported safety hazard, it might be not corrected and leading to future accident. When near miss happened, you should fix the hazard immediately, and you should mitigate in future to happen there again. And also, like said, to non-blame culture of the people. When you have an accident, we need to solve the system, to solve the problem, to solve the problem in the system, not to put finger to our people. Stop work authority. Also, you need to allow your people when they have any unsafe action, unsafe condition, unsafe position, they have the right to stop the work, and you need to learn him. You need to give them the trust. Some organizations, they have a program in place. It is something like empowering a worker to halt a dangerous situation, can help prevent injuries. Not only that, but worker also some worker can refuse to work in a dangerous situation. Also, we need our people to be proactive, be supporting your staff abilities to stop work in hazard situation. You enforce your safety culture, keep in Bilwi that to take the corrective action against any hazard, and also teach them that they have the right to stop the work or dangerous situation, and teach them how to stop how to spot the hazard. This increases accountability among your team. Last ones that I need to say, contractor management. I can share something here in BFI, double standard. We have one system for all BFI. Whatever it is a contractor, employee, subcontractor, we have one system for the welfare of the people, working hour, food that we give. I can give an example like security guards or shift button. They have the same meals that we gave it to this contractor, our contractor. We gave it to our operation. Working hours, same. They work 4 days on, 4 days off. So all of this system is I can say one system for the whole organization. Like I said, whatever it is, contractor, whatever subcontractor, cleaner, all have the same system. All of this is helping to build safety culture, because you cannot say, yeah, this is only my staff. I implement this standard to them, and I have different standard to subcontractors. I see before some subcontractors work 6 days, 12 hours a week, and our staff work 4 days only. So we have to improve all of this to build a culture among your organization, because if you have any accident from this subcontractor, it will affect your statistics also. So you need, what I mean, that to build one system. When you have any scheduled turnaround or any subcontractors come to your organization, you need to like that improve them, like that quality of PPE. The PPE that you use it in your organization, you need to enforce anybody work in as a contractor or subcontractor to use the same quality, because if you intervene somebody and he did not wear his safety glass, and you ask him, and the safety glass is a bad quality, something like that. So all of this issue, it will improve the safety culture. So last one is,
Sorry,
we
Tuan
can
Yasir.
say,
Sorry, Tuan Yasir, the time is, I know if you can wrap up the presentation. Thank you.
yeah. Yeah, I just, hello?
Yeah.
Just I need to add the last word. I follow the rules because I have to. I follow the rules because I have to. You need to hire, if your organization have 100 employees, you need to hire 100 safety personnel to monitor all of them. I follow the rules because I want to. This is what we need. Like I said, we need to sell safety, and we need to our people to feel that we are care about them, and the safety is all of us responsibility. Thank you very much.
Do we still have time?
Sorry, Tuan, the time actually exceed 15 minutes sudah. So
Okay.
maybe just as Anuj je kali, 1 minute summary maybe from Tuan Dudi to wrap up the presentation from BFI. Thank you. We give 1 minute.
Okay, could you go to the next slide? The next slide. And open all. From Engineer Yasir, what do you want? No, the previous one. The previous one. From Engineer Yasir, that's the way that we're going to build a good safety culture, because safety culture ladder is like an evolution. To begin from pathological, that basic on PPE, then change to reactive. People evolve from learning from an accident, then implement the system called calculative. All of these three will lead to a proactive, because we start from the top. Safety leadership and values drive continuous improvement. Once the system is involved, then we integrate people in family, social, and everyone will be as one unity to build a safety culture ladder. Then the next one will be sustainable, because we need to continuously practicing safety, not just only in work site, also at home. So safety become a part of your mindset daily. Lastly, it's a generative, when from the top down, from the management to the staff, from the family to the staff, and even the country, then safety perceives to be an inherent part of the business, of a life culture, and the workplace. On the last slide, we're mentioning that we follow safety because I want to, not just because I need to, but I also want it to do it safely. Be very careful, because all of this will be slip if people become comfortable. Complacency and bureaucratic tendency, continuously doing it, become a routine, and without what we call conscious on safety, and you will lose everything. Thank you very much. That's from our slide.
Thank you very much, Tuan Yasir and Tuan Dudi, for the presentation. There's no doubt that there should be a visible management commitment as been presented earlier in order to build a good safety culture within the organization. Without further ado, we'd like to move next to the construction industry. We're glad to have a representative from Swiss Sdn Bhd, Yang Mulia Puan Siti Zubaidah binti Awang Masuni, the HSE officer of Swiss Sdn Bhd. So without further ado, please welcome Puan Zubaidah.
Thank you for the handover. And firstly, I would like to say, express my gratitude to Sheena for the invitation for the webinar. We're truly honored to be here. So just to introduce myself, I'm Dayang Siti Zubaidah Awang Masuni. I'm the HSE officer for Swiss Sdn Bhd. So for today's webinar, I will be speaking on building a positive safety and health culture in conjunction with the World Day for Safety and Health at Work 2002. So next slide. So before diving into the safety and health culture, we have to understand first the concept of it and what it means. So here, safety culture can be defined as the outcome of shared attitudes, values, beliefs, mindsets, perceptions, and patterns of behavior in the organization or in the company, which determines the management's commitment to health and safety management. So in other words, this is the cumulative effort of attitudes and mindsets and behaviors from all levels of the company or all levels of the organizations, from the management, going down to the supervisor level, and then going down to the workers. Next slide, please. Okay, in assessing the safety and health culture, the first one is through the Health and Safety Management System, or the SMS, as per requirement. And then also having clear and understandable HSE policies, having proper guidelines, system, and procedures. So with these policies and guidelines and procedures, what we do is that we relay this to the workers through safety induction, for example, and then from time to time, we do conduct a in-house safety awareness training throughout the year. And then we also make this information accessible to the workers through posters all over their bulletin boards, at the rest areas, offices, quarters, and so on. And then also trainings, which includes non-specialized trainings. So for example, the safety induction and the in-house safety training that I mentioned. And then as well as specialized trainings, which includes like excavator operator training, bulldozer operator training, first aider and first warden, and so on. And then last but not least is being resourceful in terms of legal requirements. This includes the WSHO, for example, general provisions, and for our industry, specifically in construction. And then also Sheena, IGN, and WSN, and so on. Next slide. So during the COVID-19 pandemic, there were several preparations that we did. The first one is following the latest Ministry of Health's standard operation procedures, or we call it the SOPs, and we relate this SOPs to all the workers. So part of our IITS is that we conducted COVID awareness briefing to all the workers during the first wave of COVID in Brunei, which is back in March 2020, and then we did another briefing again during the second wave in August 2021. Now, the reason being that we did this twice is that the time gap between the first wave of COVID and the second wave of COVID is rather huge, in which Brunei has been COVID-free for more than a year, I believe, if I'm not mistaken. So between the first wave and the second wave, the regulations have definitely changed. So for example, now there are curfews and so on. So we needed to rebrief the workers again to make them aware of the latest regulations. And then also making vaccination to all personnel mandatory as per requirement. And then also implementing monitoring programs such as conducting ART tests on a bi-weekly basis. Additional preparations that we did is that compiling database details of all the workers, and then also appointing focal person of each of the several teams on site, and then having enough accommodation for any positive cases and close contact. So up until today, we still have one designated isolation block in any case that we have any future COVID positive cases here on site. And then last but not least is the monthly disinfection program for offices and quarters by third-party contractor. Next slide. As you can see in the pictures, this is our isolation block on site. If you can look at the middle bottom photos, you can see that our isolation block is actually separated from the workers' quarters, which is the block A, block B, block C. So we did this so as to contain the spread of the virus. Next slide. Okay. As with everything, there are challenges as well in implementing a positive safety and health culture. So some of the examples is that there are lack of commitment, so the workers are not showing interest in knowing about safety, and then lack of resources, and then time consuming, where they would rather take shortcuts, especially when they are on a tight schedule trying to meet deadlines. And then waste of money, ignorance, external influences, and then lack of IITS. So this could result in workers failing to understand that everything that they do actually have consequences. So what happens is that risky behaviors or risky practices gradually become acceptable to them over time because they are getting too comfortable with the risk. So this is why we need that IITS for all employees and workers. So they think safety is not important. And then another example on our side would be another challenge would be language barrier, in which there is an increase in cultural diversity. It means that there is a gap in communication. So this could result in workers being unable to follow instructions clearly and precisely as we wanted. Next slide. Okay. So this is the key aspects in achieving an effective, positive, and health culture. We need to understand that teamwork is important at all levels and being proactive, and then also to do or to act on it, not just on paperwork or not just like all talk. As the saying goes, action speaks louder than words. And then also having that transparency, making providing the information accessible to all workers, to everyone. And then also having discussion this way, we can get a two-way interaction, not just with the management or with the workers, rather than just like dumping information to them. So having this two-way interaction means we can also get feedback from them. Another way to get feedback would be like hiring a third-party company, like for example, a third-party auditor, or could also be from China regulatory inspection. That way we can get feedback as well. And lastly is to don't wait until something happens to you and then only then you want to take action. Next. Okay, so just to conclude, at the end of the day, the point is that we want to have everyone to have that mindset that safety is actually everyone's responsibility, not just from the HSE team. Okay. So. Yeah, next, okay. Thank you very much. That is all from Safety, Swiss and Darren Bahai.
Thank you very much, Puan Zubaida. There are no doubt that there are so many challenges to implement a positive safety and health culture, especially within construction industry. And of course, management and staff commitment is actually one of the key elements as being presented earlier. Thank you again, Puan Zubaida, for sharing some thought from the perspective of construction industry. Ladies and gentlemen, we are glad to announce that this year, World Day for Safety and Health at Work event, we have several series of webinar and event lineup to commemorate the day. Today is the first webinar where we features a different industry representative. Next week, on the 20th of April, we will have the official launching of the World Day for the Safety and Health at Work for Brunei Darussalam. Inshallah, will be launched by Yang Berhormat Minister of Energy. We will have a special videos as well featured during the launching, so please stay tuned on the Shina social media. The event will also followed by the Majlis Doa Kesyukuran and Salat Zuhur berjamaah on the same day. And in May, there will also be a photo and video contest open up from the 1st until the 31st of May 2022. There will be an interesting prize to be won as well for the competition. And on the 16th of May 2022, we will have the second live webinar where we will invite some speakers from the government, regulators, as well as the safety and health training providers. So you can as well RSVP you can register now actually, the second webinar that will be conducted in the 16th of May using the link as stated on the screen. Yeah. And lastly, on the 17th June 2022, there will be a Friday sermon to be featured nationwide with regards to the World Day for Safety Health at Work. So everyone, we will now have a quick 5-minute break. So after the break later, we will have another 3 more speakers to present. So please stay tuned with us. Thank you. Distinguished ladies and gentlemen, welcome back to the Sheena webinar session with a title, Build a Positive Safety and Health Culture. So we have several keynote speakers to present for the second session. So now let's invite our next speaker, Yang Mulia Puan Siti Rahmah binti Haji Jamil, the HSSC Senior Assistant 2 from the Prince Plus Sendirian Berhad. Please welcome Puan Siti Rahmah.
Okay. Assalamualaikum and good morning, everyone. Can you hear me? All right. So, let me introduce myself again. My name is Siti Rahmah binti Haji Jamil. So, I'm the HSSC representative from Print Plus Sendirian Berhad. So today I will be touching upon the concept of safety and health culture and the assessing of the safety and health culture in the organization. I will be also sharing our experience on how Print Plus manage our positive safety and health culture during this COVID-19 pandemic situation. I will be also touching upon the challenges that we face when we try to implement positive safety and health culture, and then I'll be also touching upon the key aspects on how to achieve effective positive safety and health culture. Next, please. All right, so just a brief introduction on Print Plus Sendirian Berhad. We're actually also a young company. In fact, that we are actually we transitioned from government printing department, which was previously called Jabatan Pencetakan Kerajaan, with a long-standing history of 35 years. So now Print Plus has become a full-service commercial printing company that we also accommodate both the local and regional printing needs. So there are a few top-tier projects that we do, such as Pelita Brunei. We also do Mushaf Brunei Al-Quran, Royal Wedding Books, and programs Dirgahayu and Yasin. Next slide, please. All right. So when it comes to culture, to having a safety and health culture, it means that everyone having similar ideas, minds and ways to approach and resolve an issue. It means that it's how we do things here. So how we assess safety and health culture in Print Plus, we did a general survey on the safety and health landscape in Print Plus. So we do this by interactions, doing observations, and doing assessment. So we talk to the employees in general, asking them about their safety practice, and then we also conduct meeting with them. We want to measure the safety and health culture in Print Plus. So we also observe their work activity, example, looking at how they do their work activities. For example, if they are doing toolbox stock, are they SOP compliance as well? So we also see whether their safety signages in place, are they wearing suitable and appropriate PPE. So when it comes to assessment, we also do a general risk assessment. We also do job hazard assessment as well. Next slide, please. All right, so pandemic situation wasn't ideal for the majority of the organizations due to its impact to the business operations. So these are the things that we did in Print Plus, to make sure that the safety and health culture is well managed here. So first, we have a business continuity plan, BCP. So again, back in 2020, we actually still use our predecessor, which is Jabatan Pencetakan Kerajaan BCPs, but we did revise it, and we update our BCP accordingly during the second wave. Yeah. So we implement COVID-19 BCP and we revise it according to the current situation, and then we use BCP and it sets our approach in managing COVID-19 with consideration to the nature of our business. So having constant communication, with fellow colleagues, be it formal and informal, we tell them what's going on, what we are doing, and what to expect from all this uncertainty. We also make sure that the line managers inform their team members so that information are properly communicated and understood. So we also keep up with the current and reliable information. So there's new guidelines, new information about COVID-19 because the situation is fluid, and it's ever changing, hence the need to be up to date with current information. So of course, standard SOP is fully enforced, such as poor health scan, green code and yellow code, mandatory wear of the mask, no signs of flu symptoms or fever, social distancing, and definitely practicing good hygiene. Yeah. So when implementing such a SOP, we actually played our part by providing hand sanitizer as well as face masks. We have posters in fact to strategically placed throughout the premise on proper hygiene procedure. So we also collect data for contact tracing, and it also becomes a tool for us to analyze period of infection. So when Red Bull Health Code are allowed to work from home with guidelines, we use similar guidelines, but with exception. Primary contacts are not from household source, yeah, because based from the data, we are able to identify that cross-infection employees turn positive has higher percentage when they are from the household source. So approximately 43% of the employees turn positive within 3 to 6 days due to positive household members. And then we also collect data on vaccinated employees. We encourage them and celebrate their active measures. We support them. We have this Hall of Fame to inform everyone that who has been fully vaccinated and then who went for booster. Right. So in our constant worry of pandemic situation, we also consider the mental health of our employees and how it affects their day-to-day lives. So we invited speakers from the Ministry of Health, to talk about mental health. With the program, employees are able to know the importance of mental health, and recognize when their mental health is affected. So for a continuing program, we actually send our employee as for mental health first aid training, and they will act as a mental health champion to advocate the program. Next slide, please. Right. So there are quite a few challenges we face to implement a positive safety and health culture in Print Plus. So we just transitioned from a government department to fully fledged commercial printing service or corporatized printing service. So there's a lot of cultural differences and a lot of cultural clash, because it is between the previous culture from the predecessor and the new one. So it's about accepting this transformation, to try to blend in the culture. It's not as easy, so by maintaining the certain aspect while introducing new ones, appreciating the old culture while embracing the new one. So when it comes to visibility, so it's keeping safety and health with visible presence, to make them understand that safety and health is part of daily operations and activities, and that it's just as important as producing output. So when it comes to employees' participation, to get them to participate and ensure that all employees from all levels feel welcome and valued for their contributions, and that they can always approach us for any matters pertaining to safety. So that in itself is a building effort for us, So when it comes to resistance to change, so remember that with over 35 years under our predecessor, so it is understandable, to introduce new aspects and to change their perspective is not easy. Perhaps previously safety and health is just something that is good to have and not a must have. So we're trying to change that perspective and mindset. So again, this relates to the adaptability, to build a good and sustainable safety and health culture. It takes time, so old habit dies hard. So just imagine that a person, an employee that has worked with our previous predecessor probably more than 20 years, and then suddenly thrusted into new companies with introducing new culture and whatnot. So it's not easy for them. So old habit dies hard, and when they come around and understand the importance of safety and health, we also need to look at their perspective of accepting the changes slowly as well. Next slide, please. So here there's definitely a lot of aspects to achieve a positive health, safety and health culture. For example, clear communication, definitely. Instructions, feedback, input, it must be clear and understood. And then having a management support, I think that is one of the key aspects as well. Buy-in from the management, and their support must be visible. And then collaborative engagement, promote cooperation between employer and employees, to maintain and achieve a safe and healthy working condition. Having a safety and health policy as well in place so that it sets out objective and acts as a guide. And then managing expectation, be clear with targets and deliverables, and make sure that targets are within expectation, that we do not overestimate. And then shared responsibility. Responsibility doesn't fall under one person. It doesn't fall under safety and health team only. That is actually everyone's responsibility. And then making everyone understand that there is implications and consequences when we are not complying to legal requirements. So this is the part where a majority of the people that are not aware of, that we are actually under the purview of legal requirements. Yeah. And then providing instructions, supervisions, and trainings, providing suitable, appropriate instructions, supervision, training. And for example, quite recently that we introduced a training, 5S training, we call it. It's very useful in the manufacturing industry, and it is actually widely used. Yeah. And then inclusion of safety in all aspects, include safety agenda in all methods, such as during meetings, in the work activity, and so on. So next slide, please. All right, that is all from me. Thank you very much. So back to you.
Thank you very much, Wan Siti Rahmah, for the absorbing presentation. Indeed, promotion and telecommunication is an important element to ensure positive safety and health culture within an organization. There are lots of learning and also good practice that has been presented in today's session, where it can be replicated or absorbed as well to your respective workplaces where applicable. We also can see some discussion on the chat box. So thank you very much to the audience who are sharing some thoughts as well as some comments on today's themes on the safety and health culture. Ladies and gentlemen, let's divert our attention now to the food and beverage industry. We are glad to have our speaker, Yang Mulia Tuan Muhammad Aisamuddin Ali Omar, who is currently holding the role as HSE Executive at SPHI Foods. Please welcome Tuan Aisam.
All right, thank you so much, Tuan Zahar. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Distinguished guests, ladies and gentlemen. First of all, I would like to say thank you to Sheena for approaching and inviting us to present in this webinar in conjunction of World Day for Safety and Health 2022. It's an honor and privilege to be here. Today, I will be presenting a topic on effective communication and maintaining positive OHS environment in workplace. Next slide, please. This will be the overview of the presentation from my side today. So just a brief introduction of the company, and then second point will be the Pdca approach, and lastly will be maintaining positive OHS culture. Next slide, please. All right, some may know who we are, some may not. SPHI Foods has been incorporated and running since 30th of November 2006, and this company is a 100% Bumiputra. This company started as a humble kiosk selling our own satay brand name Satay Haji Ibrahim, and we are currently have around 7 branches running this retail business in Brunei Muara district only. Since 2015, we have ventured and expanded the business into oil and gas industry. We started with running a canteen services, which then Alhamdulillah, we are awarded for offshore catering. Next slide, please. As for assurance, SPHI Foods has been keen to show its commitment to pursue certification, not for the sake of having a good paper to be shown to the clients, but to ensure that we're having a quality and robust system that runs in the company. So what drives us to pursue this certification? This is because we do care for our client satisfaction and the satisfaction of the people that are working in the company. So we are certified with ISO 9001, ISO 45001, HACCP, and also Halal. Next slide, please. Inshallah, back to the main agenda of this presentation. So my presentation will be more into a scenario-based presentation. So in F&B industry, especially kitchen operations, we do have an ease feeling towards our kitchen operations, even though after working hours. The thing that worried us the most is gas safety appliance. Just a quick throwback. Maybe some of us have read or remember regarding gas explosion incident happened last year, October, in the Lumut terrace housing. The aftermath of the incident, 2 local incidents sustained light injuries and caused damage to the house and nearby vehicles. Upon investigation, it was caused by gas leakage from LPG gas pipe. So ladies and gentlemen, we do use gas appliances at our own home, and sometimes we tend not to care the safety of it, as we only look at other aspects such as electrical appliances, slippery floors, and many more. Let me share with you on what has been done from our side to tackle any possible hazard on gas safety appliance. Next slide, please. We are using Pdca approach. So what is Pdca? So P is plan, D is do, C is check, and A is act. So these 4 stages, it must be done in sequence to ensure the effectiveness of this approach. So what do we mean by plan? So plan is pretty straightforward, I'll say, is to do a risk assessment. So our approach is usually we do sit down with the relevant team members such as supervisors, kitchen team, HSE personnel, and also the management side to give inputs and brainstorming on what things should be looked into. And we do seek for feedbacks and learning from past experience or from any incident sharing that has been cascaded from similar situation. As usual, our priority will be the safety of the people working in the company. Then we look into other aspects such as assets, community, and the environment. And lastly, once it has been finalized, we will capture it into our job hazard analysis or JHA according to our own metrics. Next is do. So as for do, it is the actual implementation of the control measures that has been discussed and agreed during the risk assessment, which consists of first training. So it may be done internally or by sending to training center. For our kitchen team, we send them for food handling course, which also covers few bits on usage of gas safety appliance. Second one will be a reminder. So it needs to be done constantly, especially when monitoring the kitchen team. And then thirdly, the actual action, such as a gas snooping test, and also installing gas detector as an early detection for any leakage. And lastly, which will be eliminating the risk, which is by installing two-way valve from inside the premise and also outside of the premise. In case of emergency or leakage, the kitchen team can just shut off the valve from the inside premise as the valve was installed exactly next to the exit door. We also removing the gas regulator every time end of shift, regardless in the morning or night. And then thirdly is check. Check is verification of what have been taken into action. Merely it is a verification of quality documentation in a sense to empower responsibility and accountability to the team members when executing the control measure. This is also to ensure that the control measures put in place is adequate and safe to be continued. Lastly is act. This final stage is to validate if the control measures are inadequate or requires further action or attention. It may be done from various mediums, such as first will be the audit. So it may be done internally or by externally. And second one will be communication, which is having a discussion with respective team or to involve the management as and when required. Thirdly is to understand the root cause if there is any incident or near misses involved. Lastly is to review the effectiveness on the planning for further continual improvement. Next slide, please. Here is the sample of risk assessment done for operating our gas cylinder, which we capture everything since the gas cylinder has been loaded to our premises, the setup, the operations, the cleaning, and also when we are done cooking inside the kitchen. Next slide, please. So this is the sample of do. For this, we will use a hierarchy of control approach, where our kitchen supervisors will ensure the team has been reminded and cascaded on gas safety either during toolbox talk, internal training, info sharing, and safety stand down. The kitchen team will also update in the group on their activities, especially when they're conducting the gas snooping test. Can you play the video? Okay, here is a video on how they conduct the gas snooping test. The team will not only do gas snooping tests on the gas line outside the premise, but also inside the kitchen to all the hoses and valve. And lastly is by removing the gas regulator, which is totally eliminating the hazard. Next slide, please. Then check. As I mentioned earlier, it is a verification of what has been done by the kitchen team. Usually the person who conducts the gas snooping test or removing the gas regulator will sign a form and share the videos or pictures in WhatsApp group for everyone's awareness. The supervisor will verify the documentation and final check will be done by HSE personnel. Weekly hygiene and safety inspection also plays big role to ensure the cleanliness of the, not only to ensure the cleanliness of the project location, but also to capture any safety finding related. Next slide, please. Last but not least is ACT, which we usually discuss and raise any safety related matters during our weekly ops meeting, monthly safety committee meeting, which we involve the top management in the discussion and for follow-up. We do have accident control technique or ACT card, which have the same function like PACAD, intervention card, or any other things that may be used to report any findings that is unsafe. Next slide, please. All right, all the things that has been shared lead to one conclusion. Pdca approach is actually practicing a transparent communication towards all employees, regardless from frontliners or to the top management. Communication in the end is the key to everything towards the success of maintaining positive occupational health and safety culture in the workplace. This is due to, we can see the commitment of the management side that is visible to all levels of employees and showing support by involving into the discussion. Then having a consistent and highly quality communication between all personnel, where in Special Foods we seek for active participation by asking for feedbacks from the end user, which is our frontliner, because they are the people that are exposed to the risk. Again, we are not only listening to their feedbacks, but also to consider what they really feel or need. And then we give a clearer definition of their responsibilities and the accountability towards achieving positive OHS culture. Then have an effective communication metrics, which is a medium for the people to do reporting. It may be done via proper reporting or by verbal. And lastly, to ensure to have a quality meetings that we need to ensure that supervisor have a adequate and accurate info before cascading to the team members and send for the employees for any trainings that may be useful for their knowledge and which may be done internally or by sending to the training center. Next slide, please. Inshallah, that is all for my presentation, and I hope the sharing is beneficial for everyone, including to the person speaking himself. Let's together move towards a better life where people will have a positive mindset to maintain positive OHS culture, not only at workplace, but applies in their daily life and be aware of the importance of it. And then you may reach us on the screen, either via email, phone calls, and you may enter our website for further info on what services we are providing. On this occasion, I would like to apologize if there's any lacking from the 10-minute sharing or accidentally extending the time given. Lastly, may Allah subhanahu wa ta'ala protect us from any harm and any uncertainty. Allahumma amin. Thank you and stay safe.
Thank you very much, Tuan Isam, for the insightful presentation. Glad to see how the PDCA concept has been approached, to manage the safety and health for the organization. Food and beverage industry may seem smaller in terms of scale, but regardless, accident can still happen in this type of workplace. So thank you for sharing the good info and as well the learning from your organization, Tuan Isam. The audience, we hope you are all still with us this morning. Now we are coming to the last presenter for today's webinar. May we please welcome Yang Mulia Tuan Pangeran Muhammad Ramzi bin Pangeran Haji Zahari, HSC Manager for Brunei Methanol Company Sdn Bhd.
Assalamualaikum and a very good morning. Thank you very much, Zahar. So representing BMC, myself is Pangeran Ramzi, the HSC Manager for Brunei Methanol Company. So again, thank you very much, Sheena, for giving the opportunity to present for this special day. Not only special day, but every day is safety day. But again, for the World Day for Safety Day and Health at Work 2022. Next slide. So for this slide sharing, so there will be two agenda. Okay, so first one is how a general refresher on the safety and health culture. And secondly, how success that BMC implemented and continues improve with the support of Sheena NTI, thank you very much, and also for the other relevant authorities, okay, during this pandemic situation. Next slide. Okay, so again, to share the relationship between safety culture and safety performance. Okay, so having a good safety culture, thus we will have produce a good safety performance. Vice versa, if we have a poor safety culture, we'll have a poor safety performance. To measure it, so we will look into the ways of things are being done in the workplace. Okay, so furtherly in the slides after this, I will share how BMC is successfully implementing the good safety culture. Okay, next slide. So there are two columns here, the good and bad, so positive and need attention for indicators. Some examples are management commitment to safety, the visibility of leadership, a very good safety policy so that the employees can follow and comply. Again, thank you, Yasser, mentioning about the training and competency. The importance of this training must be completed and valid. Okay? And then for the retention of people, and incidents are being investigated and follow up with the close action items. Moving to the other columns, so basically the need to be intention, the indicators is, some of it is the high rate of sickness, finger pointing, high staff turnover, high complaints, accident rates, and so on. Okay, next slide. Having a benefits of positive safety culture. Okay, so we value the employee safety. So the leaders value employee safety. The employees feel empowered of safety culture and health and so on. Okay, so employees feel ownership and the investments are made in safety procedures and programs and equipment. Okay, next slide. So, okay, so moving on. So how BMC achieve it, implement it during the year 2021, just to share some accomplishment and achievement. So Alhamdulillah, with the grace of Allah subhanahu wa ta'ala, we have 0 LTI during our turnaround schedule. With the successful HSC management during the turnarounds, okay, we have been given Sheena HSC management leadership. Thank you. And we completed all the relevant compliance authority, which is part of also a safety culture. And lastly, during this pandemic, difficulty of bringing people. I thank you from MOH also for having the opportunity to allow point-to-point arrangement for repair works. And of course, we are very proud of the BMC Process Safety Management Program that we've been implemented. And also we are part of the CCPS Global Committee. Next slide. Yes, just to share that we have already reached our 7 million hours, Alhamdulillah. And we're forecasting in this July, to reach our 8 million hours. Thank you for all the BMP employees to make this happen. Okay, next slide. This is some of our leadership that we've shared every quarterly. So within the quarterly, within the bulletin that there's been shared the agenda, safety concerns, safety improvements, and we recognize our people here. We share the appreciation to their awards. Okay, next slide. So sharing of knowledge is one of the safety and health culture. So every month in all our section within HSD, so health, safety, security, environment, and process safety management, monthly we are sharing all the knowledge here, and we give opportunity to our employees to compete or quiz that they will have some prizes to be won. And in the end of the year, they will have the opportunity to receive a certificate and a draw that to appreciate their safety and awareness. Next slide. Okay, so as mentioning earlier, we have plans and achieve as the completion. So we have an HSE plan. HSE plan is the way we make things work. So the result from this will have a good safety culture and also a good safety performance. You can see on the top there, of course, our strategy is to comply HSE policies, procedure, and regulation. Below it, we have divided into our sections. And in the planned activities, this is some of the activities that we plan for this year. And then we monitor in the performance monitoring, leadership. And lastly, our goal is to have the goal 0, no non-compliance, no injury, no property damage, no environmental impact, no process safety incident, no security breach, and of course, to make Brunei safe working place. Next slide. This is some of the HSE turnarounds implementation steps that we've been conducted. Some of it is being applied to other industries in Brunei also. But again, just to share that for this World Safety Day, that we've been complying and also improving the way it is. So some of it is, of course, is the implementation of the lifting authorities, scaffolding, daily meetings, HSE awards, implementation of safety manuals, and so on. Next slide. Okay, so during we comply all the necessary given thank you from MOH and the rest of the ministry to help the citizen of Brunei to continue our business continuity plan. So we activated our task force team. Okay. So we align, we take care of our people. Okay, so next slide. Next slide, yeah. So of course, we support our welfare to our people. We divide it into internal, external, and company. For the internal, we address to our positive cases, our quarantine order patients that they are not able to go out. So we present them some essential items, you can see. Okay, so of course, for the external, so we send some monetary fund, medical supply, learning equipment to MOE. Next slide. Some of the pictures that I'm sharing here is just to see how my team and the people in BMC have done well to achieve a good safety culture. Okay, you can see some of our health nurses, they've done their part. Our leadership appreciating our people. Okay, next slide. from environment and process safety, we've been continuously supporting the government industrial committee meeting, industrial ritual, which is the BCCS, Brunei Climate Change. And then part of the CPS, as mentioned earlier, we are part of the Global Summit on Process Safety, well known. Next slide. External engagement. So we've been involving ourselves continuously with China, okay, with BFI and the rest of the industry. Next slide. And lastly, that we really appreciate our team, our personnel. Here you can see that some of the personnel of our HSE team that been working really hard to achieve this goal, not only the HSE team, but also the rest of the BMC employees. Thank you very much. So I hope that, next slide. I think that's it. I hope that by sharing this, give some motivation to the team and the rest of the companies in Brunei to make a better safe working place. Safety is our priority. Thank you. Okay, Zahar, pass to you.
Thank you very much, Tuan Pangeran Muhammad Ramzi. Indeed, an interesting presentation to share to all audience out there on BMC achievement as well with regards to the safety and health. Of course, again, promotion and communication remains the important piece towards improving the safety culture, within the organization. Okay, ladies and gentlemen, for the next agenda, we will move now to the question and answer session. So I will pass now the floor to my colleague, Puan Shazwana binti Sholyono, to lead the moderation session. Thank you.
Okay, thank you, Zahar. And thank you to all the speakers as well for the very insightful and interesting presentations throughout the day. Can I have all the speakers switch on your cameras, please? Okay. Hello, nice to see the speakers' faces again. All right, so we have a couple of questions that we've received through the chat box. I think we will address those ones first. For the first question, if I can get Jamie to answer this one. It's a question from Muhammad Abdullah from the chat box. Is there any particular training or requirement focused towards managers or senior personnel within an organization to enhance their safety attitudes? This is considering that the management attitude and commitment is a very big driver in a positive safety culture at the workplace. Jamie.
Yeah, thank you very much, Wana, and a very good question. I think what we must understand is that the managers in organizations play a vital role in the success of the organization, not only from a business point of view, but also from a cultural point of view. And I think for general training, if that was the easy solution, it would be something like an IOSH managing safely, or HSE managing in construction or something similar, depending on the industry sector that they're involved with. But I think there is more to it for managers, and it's their ability to not only collaborate with their staff in initiatives that an organization undertakes, whether it's town hall sessions or some of the initiatives that some of these presenters, our distinguished presenters, have shown us today. There are many initiatives that come out, whether it's bulletin boards, messages, where senior leaders can provide their messages, can be involved actively. And in the near future, with the industry HSE group probably coming online, we may have an opportunity for senior leaders of various organizations to become more actively involved with industry matters as well, where HSE is front and center for everyone. Thank you.
Thank you, Jamie. Yeah, so higher management involvement can be done in various ways, as we've heard from Jamie. So they just need to actually take the time and make the effort to show themselves, be visible in a lot of different ways. All right, I think just a reminder to the participants as well, if you want to ask any questions, you can also use the raise hand function. So I'll try to go between questions from the chat box and any hands raised as well. So for the next question is from Mr. Terry. I think it's directed to Yasser from Tuan Yasser from BFI. It's about near miss reporting and mechanisms in place to encourage near miss reporting so it can provide opportunities to learn and prevent potential accidents. So how is BFI managing this near miss reporting? Tuan Yasser?
Near miss reporting, we have safeguard system. So anybody find any near miss or unsafe condition, he immediately fears a safeguard. Then in HSCE, we take it seriously and we start to investigate how this near miss and take the corrective action. And in monthly, we have a monthly report to all the staff and the management. We share all the finding and we share the corrective action and how to prevent. So we need to have safety time out if have a serious near miss, stop the work, and we start to discuss with the people on site, because plant now we are in commissioning phase. We just finished construction phase, and we are in commissioning phase with our EPC contractor and also BFI team. I hope this answers your question.
Yeah, I think if Terry has any any feedback, he can write it in the chat box. But I think you've covered it quite well, Tuan Yasser. I think just staying on the topic of near miss reporting. So it's important to have a mechanism in place, and from Tuan Yasser's answer, it's also important to actually discuss the findings of this with other workers as well as learning. So I think it would be interesting to hear from Puan Siti Zubaidah as well on how near miss reporting and maybe sharing of information is done within the construction industry.
Can you hear me? Right. So with near misses at our site specifically, usually it is being reported, and we do have a report system. And what we did is we usually implement LFI, learning from incident, not necessarily from accidents, but also inclusive of near misses as well. So what we do, we also include this in, like I mentioned before, we do from time to time, we do an in-house safety awareness training. So depending on their topics, so that's where we sort of like inject their near misses according to the topics.
Okay, thank you, Siti Zubaidah. That's very reassuring to hear. Hopefully, other construction companies within Brunei will also start practicing this as well, and we can help reduce the number of fatalities and injuries that we see at construction industries, which is usually the highest on a national scale. Thank you. Okay, moving on to the next question. Just checking, no hands raised so far, so no one's feeling brave today. It's okay. We'll stick to the chat box questions for now. Okay, this question is also from Terry. It was for Dudi. I think this is on the part of the safety culture ladder, where there's 2 additional layers. So I know Dudi's already kind of addressed this in the chat box, but I think we want to give Dudi some time to actually elaborate more on the safety culture ladder, because that's an interesting concept that wasn't really explored. It was summarized. Yeah. So Tuan Dudi. Yeah, okay, maybe we don't have Dudi with us right now. If I could pass it back to Tuan Yasser, maybe if you can touch briefly on the safety culture ladder and how companies can work towards this. No, I'm muted. You might be muted, Tonya, sir.
Yeah, you're muted. So, like I said, to have a safety ladder, be reactive. Reactive is you need to just not to wait to improve after you have the accident. You need to be reactive before. Second one, you need to be calculative. Calculative to have a system in place to manage all the hazard. Like I said, your KPIs. You have to leading and the lagging indicators to have a system in place like VHA, threat register to manage a risk. When you have any risk, so you need to highlight early. After that, you need to be proactive and the value of the drive to continue for improvement. So leadership, what I mean is that management, like management, have to be in the part of the improvement of a safety culture and the leadership. After that, integrative. Integrative is it's, health and the safety will be equal to be are the key to our success. What I mean that any organization we have you have the culture and you have safety. So you have it is like that. When you have organization it's considered a system, your system, policy, procedure, quality, product, all of these. Then after that you need to build the culture. After you build a good culture in your organization, you will safety in place. Also, you will improve the productivity and improve the quality, sustainability. So you need to, what I mean that to be sustainable, continue, always continue, improve, continue, monitor yourself, record, you have to measure your KPIs, like how to measure now your safety culture, how many reports you receive from your team, near misses, inspection, and also after the time. Okay, this year I received 1,000, as example, 1,000 report from my staff. Then next year, it should be reduced actually, because it should be improved in the plant. And as well. So you need to monitor yourself about the inspection. The number of near miss should be reduced when you improve your culture in your plant. Then last one is generative. So safety is, we can say, to be inherent of part of the business. Like I said, it should be a core part of the business. I cannot say safety first or equal, but of course, when you improve safety, you improve the quality, your productivity will improve. If people, they will feel, people should feel always you are care about your people. So you safety, you have to sell your product to your staff. So you, of course, immediately will improve the productivity and, like I said, improve the quality of your product. So I hope this answer.
Yeah, thank you so much, Tonya, sir. That's a very comprehensive answer towards about the safety ladder culture and what we should all be aiming towards. Thank you. So I see 4 hands raised. Well, suddenly after calling people out, everyone's brave. So we'll try to do it in order. Once I call your name out, you can unmute yourself and switch on your camera if you wish to. So we'll start with Yumi Rosli.
Wait, can you hear me? Hello?
Yeah, we can hear you, but we cannot
Okay.
see you.
Oh yeah. Okay. Happy Ramadan Kareem to everyone like who's like doing like the fasting. I have like 2 questions actually. Like my first question is like regarding the reporting culture in Brunei. So, so the reporting culture. Right? So Captain Jamie like mentions due to the lack of reporting, that's why we have like very low number of reported like work-related fatalities and diseases. So like Coming back to the questions, Ms. Suzwana posted it to Swiss number height to Puan Zubaida. Like the Swiss number height, they implement these near misses mechanisms, right? So, but unfortunately, if you refer back to the PP slides on the Captain Jamie, most of the work related fatalities occur in the construction industry. So, what can be done in the construction industry in terms of the near misses reporting because once for example risk normalization is very quite normal to certain degree, especially if you have your own team working in a construction project. So if you have the peer pressure and then the team is used to be practicing the risk normalizations, so probably they can't be bothered to report near misses. That is the first questions, especially in the construction industry. And then the second question is because the major topic from Sheena is to promote a positive safety culture in Brunei. So if you go to the Sheena website, Sheena does one of the initiative is to have the online reporting. So is there any in the future, probably Sheena probably gonna have road safety, a safety road show or any more talks in the government office in schools, because I realized on the chat some of the participants mentions this safety culture should be instilled from the young age. So yeah, is there any, because we're moving towards the endemic phase right now. So is there any plan to have safety roadshow, or even probably in the future we could have the World Safety and Health Day in Brunei as part of I don't know not festival but a gathering for all the HEC professionals in Brunei. That's it from me.
Thank you, Yumi, for the two questions. So for the first question, I think we'll direct that to Siti Zubaida from SWI, because I believe it's related to lack of reporting and risk normalization, and how can we address this within the construction industry. Zubaida? I think you're muted, Puan. Puan Zubaida, you're muted.
Oh. Can you hear me now? Okay. Apologies. Can you rephrase the question? What was actually?
Okay, I think
because it was quite lengthy, so I didn't quite catch what was it that she wanted specifically.
Okay. Yeah. So just to summarize Yumi's question, I think it's to do with lack of reporting within the construction industry and risk normalization within the construction industry as well. So how, as the HSE officer of a very prominent construction company in Brunei, how do you address this?
Okay, so as I mentioned in my slide, there's risk normalization where the workers tend to gradually they accept any risky practices because we can say they get away with it. They get away with the consequences. So what we do is when we go to site, we encourage them through posters as well and different languages, especially there's language barrier, but also having safety timeout, or we call it safety intervention. We would just take them for about 5 minutes. And then, like I said, part of the key aspects in having the safety culture is that we have this discussion with them. So that way we can get a two-way interaction with them on near misses, on reporting, in which when they first started here, they would feel like it's not necessary to report, but as we progresses, as we have this discussion, as we have the induction and training, it would encourage them more to report to the HSE.
Okay, thank you, Puan Zubaida. I think that's That's a good step forward. Hopefully that will help with increasing the reporting rates within construction. So for the question, so the second question from Yumi, I believe it's directly to do with Sheena. So Jamie will have to take this up. It's on whether Sheena has any plans to do like a safety roadshow or like a safety festival and anything targeting schools as well. So I know the answer to this, but I'll let Jamie answer this one.
Yes, thank you, Anna, and thank you for the question. So I think I'd like to firstly touch upon the initial bit about construction. I believe it's a responsibility of all employers to ensure that there are systems in place for having employees report on unsafe situations, and that is a general industry practice across the board, and construction is no different. I think we have to realize it's, as a safety officer, you have a huge responsibility on site, not only as a duty of care to people around you, but also ensuring that you are the, if I could put it simply, the policeman on site, because you are the one who can prevent the accidents by your interventions, by creating the culture on site. And if you take and you zoom that concern outward in terms of raising of awareness, you then come to the platform of Sheena. What we have already done over the last year, and we continue to do, is outreach programs such as the one we are currently engaged in, where we're trying to bring together people of different walks of life to come together and spread a message that is needed not only for the community who's with us today online, but also then taking this, the responsibility remains with you to take this information back to your networks, to your organizations, and continue to spread the right message. When we talk about having an HSE festival or a similar kind of event, I think Sheena has that planned for this year. We will, for World Safety Day, be doing a number of programs over the next month, and probably later in the year as well, during the Energy Week, be engaged in doing something more for HSE. But I think the opportunity remains with companies to do a lot more. I think we all focus our opinion to say that the oil and gas industry is the one who's raising the bar and doing HSE. But today we have seen construction companies, we've seen food companies involved with food business as well, are all involved with HSE. And I think this is it's a huge positive for us to take as we go forward. So let's not demean ourselves by saying that we need somebody else to provide us the solution. We have the solutions within our hands. As safety officers, you play a vital role, and I think you are able to support Sheena in this matter. So take our slides, take our presentations, spread the message across your organizations, and yeah, I think we can make a big difference here. Thank you.
Thank you, Jamie. Moving right along, I'm being wary of the time, so I want to fit as many questions as I can. I'll get a question from the chat box again. I'll pass this one to Puan Siti Rahma of Print Plus. There's a question from Alexius Kulupu Henry Awi, very long name. Is there any tool to check or quantify good culture? I think this was briefly mentioned in your presentation just now. So Puan Siti Rahma. Oh, no. Are you there, Puan Rahma? Okay, never mind. We'll move on to the next question. Puan Rahma can answer if she manages to join us back. Okay, this one is a question from Terry for Tuan Aisam. So for the comprehensive checklist and forms, are there any plans to go electronic so that useful information is available for tracking, auditing, verification, etc. in the cloud? Tuan Aisam.
Okay, thank you, Shazwana. Thank you, Terry, for the question. So in Special Foods, we are currently still, developing a system where we want to make it over the cloud. So Alhamdulillah, usually what I will do every time I do a weekly hygiene and safety inspection, I will do also the quality documentation on site. So from there, like I mentioned during my presentation, that there will be a checking or verification of what has been done from the kitchen side. And then once it has been verified by myself, then I will ask the supervisor to scan and upload in the shared folder. So usually that's our practice for now. But again, that's a good suggestion for us to have electronic documentation so that it will be available for any audits or any how do I say, tracking. But yeah, that's our practice as of now, which is to scan the documentation, and there will be it will be checked by myself via OneDrive. I think that may answer the question.
Yes, I believe it does. If Terry does not find that satisfactory, he can go to the chat box and complain. But thank you so much, Donaisam. It's really cool and interesting to see how technology is kind of getting merged together in the HSC industry, and like we're getting very high tech with how we're monitoring things. So, you know, with the fourth industrial revolution, it's just going to get more and more tech savvy. So that's a very exciting prospect of things. Thank you. I think I'll address one more chat box question before I go to Dr. Balala. There was a question from Sri Kandi. I will rephrase the question a little bit. So he was saying, speaking on the topic of HSC culture, is usually like people in HSC positions that are very involved in these kind of things. But how do we actually get buy-in or involvement, participation from other workers who are not within the HSC department? So from normal workers, how can we get buy-in from them? How can we get them to care about safety as much as we care about it? So if I can direct that to Tuan Ramzi of BMC, please. I think you're muted. I can see your lips moving, but no sound.
Okay, can you hear me now? Okay, apologies. Okay, so Assalamualaikum and thank you very much for this question, Sekandi. So involvement, okay, as I mentioned earlier with the HSE plan, so throughout the year, for the leadership to be heavily involved with this safety culture. So the safety HSE plan is signed by our highest ranking leadership, which is our CEO. They are being reviewed with all of our management, and they agreed with this safety plan, HSE plan. Within the safety HSE plan, there's a leadership module. Inside this module, there's some monthly example, management leadership visits. Okay, this management leadership visits involves the higher executive management and also other relevant HOD managers. Okay, so they are being going around the plan, asking, talking to the people and other employees, and capture in the meeting. So other than that, we have weekly meetings and also daily updates, and also part of our we are part and again we are very proud that we are part of the CCPS, which is the Center of Chemical Process Safety Global Committee. So our leadership has been very heavily involved to ensure there's no leaks within the pipes. Okay, so again, we are being the management and also involving the employees discuss on this awareness that being shared from the CCPS. So as I shared earlier, there's several awareness that being shared every month. Okay, so they're being reviewed from the management also. So before they're being cascaded to the team. So once they completed and their quiz, so they're being given appreciation, including a certificate. This is being captured within our personal appraisal. So meaning to say this is a commitment not only from the employees but also for our management. So there's no escape route, but again, we lead here in BMC. We need to the management lead by example. Okay, so this is very important, a key factor to have a very good safety culture, and in the end of the day, to have a good safety performance. I hope that some examples that are being shared. I think there's a lot of things more to be shared, but unfortunately, the time limit here. But again, feel free to contact the rest, myself or the other teams here to share more if you want more details on it. Okay. Shazwana, pass to you.
Thank you so much, Tun Pangeran Ramzi.
Yeah.
Okay. So now we'll get Dr. Balala. Thank you for your patience. If you can unmute yourself and you can switch on your camera as well if you wish to. Dr. Balala.
Yeah, thank you. Can you hear me? Yeah, okay, thank you. Thank you very much. And it's not mine is not a question actually. Sorry, I would like to introduce myself first. I'm Dr. Balala. I'm an occupational health specialist working in JVM Park Medical Center. So, and I would like to actually this is a sort of additional comment with as Captain Jamie mentioned about initiation of industrial leaders to contribute in the future. I think I would like to propose to have a sort of occupational health and safety forum, so where they can post their questions and we can answer from various actors. For example, from the occupational health point of view, we are more than happy to help and give our inputs in that. So that is, I think, it's a good forum like what you see in, I don't know, they have seen in the IOSH UK, and they have a very good forum. So that's good, actually, good idea and good initiative, and it is like a team actually. We must work as a team. I mean, even the HSC, I know we still have some deviation. We are still in silos, right? That is the problem actually. We must all get together. Somebody mentioned about we must health safety must all, we have to consider both equal actually. They are both are important. So yes, we cannot deviate from one from another. So we can contribute and work as a team at that level. So that's what I would like to propose. And yeah, I think and I like to thank Sheena for organizing this forum and our webinar, and also to the speakers to give their presentations. I think it's very good to share. That's a good way of doing so. Thank you very much for giving this opportunity to talk, give my comment. Thank you very much.
Thank you so much, Dr. Balala, for giving us your input as well. It's always highly valued here. Okay, moving swiftly on, can I call on Kamal, please, to ask your question? Kamal, if you can unmute your mic and switch on your camera as well.
Yeah. Okay. My name is Kamal. Assalamualaikum. Morning. My name is Kamal from Pahitech Senjan Berhad. We are doing construction actually. Previously, I was with the oil and gas. Yeah. The main concern is actually how do we know that when we do a toolbox, especially to our frontliners, yeah, especially where we know that these people are not really look into what you call it the system. Yeah, it's good that we have the same system. Yeah, we have a lot of tools. Yeah, we have a lot of these KPIs and everything. So when looking at this, yeah, how do we make sure that the people that we relying to all this message, the customer level, they're not being just like a soldier. When we ask them to come, they come. They don't understand things. It's not only to work. I work for money. That's it. So how are we going to ensure that they're not coming to be a soldier? Like the boss tell you to come. You just come and sit down and listen. no communication. How do we ensure that?
Okay, thank
So-
you, Tuan Kumar, for your question. We kind of lost you for a bit there, but let me try to summarize and you let me know if that's your question. You were talking about how do we get these workers to not just come to work because they have to, but make them understand about HSE and the importance of safety. Is that correct? And how
not
do
only,
you know?
yeah, not only to work. I mean, when we do toolbox, when we do cascades of HSC things, yeah. So they just sit there and nod and keep nodding. So they are just like soldiers, right? So how do we get an approach to this? We have a lot of things that we implement in terms of the tools of HSC tools, yeah. Like all of these cascades, LF5s and everything. It's not really good that we produce this, but they don't understand. So they just sit there. The boss, you need to do this toolbox every. If not, you go out like that lah. So I mean, this is a bit of concern. Yeah, I think Mr. Jamie also understands about this a lot. Yeah.
Okay,
So-
so it's about how do we make sure the workers actually understand what we're telling them rather than we're just taking something, okay, toolbox stock, and we've cascaded information, but
yeah,
we
correct,
don't
correct,
actually
correct,
know
correct.
their understanding. Okay, thank you so much, Tuan Kamal, for that.
Yeah,
Can I say something? This yesterday. So
Oh, yes.
you might be people they are not care why. You have to review your safety management system. Review working hours of the people, because if somebody he work 60 days a week, 12 or 13 hours a day, and of course he he is tired, he is not care when you talk about safety, not safety. So you have to look for your all the safety management system, so to encourage your people, to engage your people. You need to engage them. So you might be this is the reason, because we have such an issue before when we have too many workers. Every day something. So when I talk to them about toolbox, he are not care actually. He is not care. So this is the issue.
Okay, thank you, Tuan Yasser, for your input. I think can I also direct the question to Puan Siti Zubaida, sorry, from SWI, because I understand Phytech is also a construction industry, so it'll be interesting to see the kind of practices at SWI on how you make sure your workers do understand what's being cascaded down to them. Puan Rahma.
Can you hear me? So I think here, first of all, we need to know who our audience is in terms of the toolbox, because we do have several teams. Like, so for example, there's the welding team, there's the scaffolding team, and the roofing team. So with that toolbox, it tackles specific job issues. So we need to know their what their activities is. So that way we know we're not just like bluntly giving them information, like generic information. It's more to specifically to their job scope. And with that, also there's communication is important as well. So with the language barrier here, we do have for each several teams, we have someone who is, I would say, like bilingual to understand our language, and as well as their, for example, Bangladeshi. Yeah, that's all for me.
Thank you, Puan Zubaida. So yeah, that's an interesting thing to take note of, the language barrier and also understanding the audience. I think another way we can kind of gauge the understanding of the workers is it's kind of like school, right? You teach something and then you do a test. So I don't see why that can't be practiced at the workplace as well. Maybe after a toolbox talk or by the end of the week, you do a quick survey or a quick test to see the workers' understanding, and if it's not that great, we try to understand why they couldn't get it. So I know there's been practice in other companies as well. Thank you. So moving swiftly on, I will take a question from the chat box because it's quite an interesting question directed to UNN. So Tuan Zaini. It's to do with internet cables and the cables being stolen in various public locations, but it is a huge safety and security concern. I know there has been a fatality from this kind of incident, I think sometime last year. So is this something that UNN has included in your HSC plan or has risk assessed? Yeah, Tuan Zaini?
Okay, thank you so much for the question. So this is one of the burning questions that UNN has received, so far. To answer this question, so in terms of, I believe most of the companies here, safe security is under HSC department. However, in UNN, security is not under HSC. Security is a different department HSCs. So what I can say is that I will not be able to answer the questions for this issue, as security has their own plan rather than HSC, but we will make sure that any information regarding on this cable type or any cable issues will be provided in our social medias, and as well as any other medias that we can provide to outreach to the public. So yeah. Unfortunately, I cannot answer it because this is not part of HSC scope, UNN HSC scope, as this is part of the security scope. Yeah.
Okay. Thank you, Tuan Zaini. Sorry for the nasty question. Blame that on Hafiz.
No worries.
But yeah, I think we can kind of rephrase that into the context of a positive safety culture, Jalaha. I mean, you mentioned about transparent communication between UNN and your stakeholders or members of the public. So that's also an important part of building trust and building a positive safety culture, not just at the workplace, but on a national scale as well, being transparent with our stakeholders. Thank you. I think I will take another question from the raised hand. We have Ian Sunni. If you can unmute yourself and switch on your mic, please.
Assalamualaikum. Very good morning to everyone. It was a good session this morning. A quick question, actually, in regards to mental health. How far have we gone with this issue? And I know that a few moderators actually mentioned about mental health this morning, but what specifically does it impact on the workers? Is it depression? Is there any cases of suicidal, and so on? And we know that COVID actually gave an impact to a lot of the subcontractors and had issues of rollovers and so on. Now, the question is, do we have sort of like a bridging process or a mechanism where people within the industry is safe to actually talk about their mental health issues? And probably they're hoping for any mitigations and so on. Thank you.
Okay, thank you so much, Tuan Ian, for the question. I think I will redirect this question to Tuan Zaini as well, because I remember from his presentation, he mentioned quite a bit about mental health initiatives under UNN. So, Tuan Zaini?
Yes, thank you, Shazwana. For mental health in the UNN, so we just embarked on the mental health journey. So our first engagement was on the talk that we have given to our staff with to provide awareness and to provide the definition of mental health and mental illnesses, and the different ways that how our mental health can be affected in terms of our personal life, in terms of our work life. So apart from that, we also have developed a team in our UNN. So basically, this is our HR team and HSC team for staff who wants to talk about their problems. Let's say it doesn't matter work problem or personal problem, they can and are allowed to approach any of the HR or HSC team to ask to share their problems, to share the issues. And as I mentioned as well in my presentations, that we also support staff who wants to seek professional help with a professional, either in the private sector or in the public sector. Yeah. So we provide all those to ensure that our staff are being our staff mental care are being taken care of. Yeah.
Thank you so much, Tuan Zaini. Hopefully that answers Tuan Ian's question. So it's really nice to see companies take a stronger and more serious approach towards maintaining workers' mental health and taking more care, providing mechanisms for workers to kind of speak out on how they're feeling, especially during the COVID period. It was something that I think most of us actually experienced. So I'm being wary of the time. I think I've been given a cutoff time of 11:30. So I will take the last three. Oh, I have
Shaz,
Mira
may I
Ramzi.
add,
Yeah, sorry.
Yeah. May I add on the mental awareness? Okay, so basically in BMC, so we ensure the mental awareness is being addressed appropriately. It's a very critical item need to be addressed, especially during the COVID time. Okay, so basically in BMC we hired an external party consultant. So we continuously engage them, all the employees, with addressing the issues that they're having, especially the people who are in a bubble, which they're staying away from their families. So they have been continuously motivating, and BMC itself has improved the welfare of them, providing the necessary as required food, proper accommodation, comfort on the transportation, and addressing some of the items are being raised also that we try our best to help them at this difficult situation. But again, alhamdulillah, with the help of again Sheena and the rest of the team of MYH, we are doing as best we can to address this mental awareness. Okay, thank you, Shaz. Can pass to you back.
Okay, thank you, Mira Ramzi, for adding that on. Yeah, we shouldn't underestimate how much of relief we can actually give workers or people who are struggling just by lessening the burden of the day-to-day life, which I'm having food, transportation, so they can have that mental space to kind of like focus on themselves inwardly because everything else is kind of being taken care of. So that's really nice to hear BMC doing that. Right, moving on to the other raised hands. I have two, so I think I only have time for that today. If I can open the floor to Terry, please.
Hello, thank you for the opportunity. This is really, I think I put in the chat box already, and I think Jamie has answered, but maybe Jamie just share with us what are the thoughts around a national investigation board. Thank you, Jamie.
Yeah, thank you, Terry, for the question. And I believe, as we've just been discussing, there's a lot to do with raising of awareness. So if it is by means of having industry board that looks at investigations or safety concerns and then provides necessary output through either guidance or information for industry to pick on, I think that is a very relevant approach to be taken and would be very supportive of the work that we are trying to undertake here. So the one platform that comes to mind is the industry HSE group, which is in the final stages of being formalized. And that could be an opportunity to say that as part of the initiatives that come out with that group is to identify an approach that can be taken where they use their platform to provide the necessary information and guidance to industry on these concerns that may arise. Sheena itself is already issuing what we call workplace safety notices. We also do provide information on our website on fatalities. But I think this goes beyond that because we can pick up things like industry accidents where machinery fails and people are not involved. It could relate to near misses as well, where you have something of importance that could be at a national level of interest for a whole sector. So I think there's a lot of gain from this, and I think it's something we can pick up and take forward. So thank you.
Thanks. Yeah, thanks for this for educating the community. Thanks, Jamie. Thank you.
Thank you, Jamie, and thank you, Terry, as well, with the very interesting suggestion. So we'll see what we can do with that. For the final question of the day, I will open up the floor to Michelle Tu. If you can unmute your mic and switch on your camera if you wish to, Michelle. Michelle, are you there? I can't see if her camera's on or anything. Okay. Since we are short on time, I'm sorry, Michelle. I tried. But yeah. Okay, so we have time for one more question. I think this last question I will give to Jamie because there was one interesting picture that was shared onto the chat box and a follow-up question from Pengiran Azmi. I think the picture was posted by Arifin and the question itself was posted by Azmi. So if there is such a thing as public reporting, similar to Talian Darussalam 123, that would allow public to report unsafe practices or observations that they see to Sheena. Jamie?
Yeah, so thank you for the question, very relevant. Currently, Sheena is upgrading its systems. We do have the info at Sheena, which can be utilized for providing us information from the public to raise concerns. We are coming out with a simpler version for our website or the ability to use it on mobile phones as well, where you would be able to provide us maybe a snapshot of the concern as well as minimal information that would support us. I think the concern for Sheena as the health, safety, and environment regulator is that we are looking at the authenticity of information. We are looking at referencing information to the relevant party, as well as ensuring that this is not somebody who's trying to be a troublemaker as well. So we seek the support of everyone to work with us on this. You are our eyes and ears out there, and to all the safety people out there, I think you are in the best position to intervene as well. Help us because you can make a difference, and help us because it's the right thing to do. So as this is the last question, maybe I can just close by saying that I believe today was a success. We've got a lot of good programs coming up ahead. The team is working to provide you more information in the month ahead. Work with us, spread this information to your teams. Let safety be front and center, as I said earlier. And at the end of the day, if we can change the HSC culture in the country, I think we are on the road to success, not only in business, but also for our families and for our friends. So thank you for your time and appreciate your support. Thank you.
Thank you, Jamie. So with that, close the question and answer for today. Thank you for all the participants for being so interactive in this session, and to the speakers for providing all these comprehensive, very useful presentations and answers. For participants, the question specific for each representative of each company, you can directly email them. Some of them might have shared their contact details. And thank you so much for your attention. I will pass the floor to Zahar to close the event. Thank you.
Okay, thank you very much, Shazwana. Quite an interactive moderation session. Yeah, so we have quite a number of questions that has been raised and also being answered by presenters. Thank you again for the moderation session. So with that, Alhamdulillah, we came to the end of the part 1 of the Safety and Health National Authority webinar in conjunction with the World Day for the Safety and Health at Work. Don't forget, stay tuned on Sheena social media on the 28th of April because we will be launching a video in conjunction with this World Day for Safety and Health at Work. So it will feature several organizations as well on the video itself. So stay tuned to our social media for the launching of the video. And also on the 16th of May, there will be a part 2 of the webinar, but it will features government regulators. We have several organizations lined up as well, and we also have several safety and health training providers, which is registered and approved under China as well, to be lined up as a presenter during the 16th of May. So we have posted the link there as well, so you can sign up now. But it should be next about 1 month time. Yeah. Okay. So kindly requesting all the participants to fill in the post survey. So your feedback is really needed, yeah, in terms of how we actually conduct the event. So if you have any further comment or further inputs that we can Sheena can bring into the next webinar, feel free to fill in your comment there, yeah. On behalf of the organizing committee, we would like to express our deepest appreciation to those participating in the webinar, as well as to all the presenters who has been quite cooperative as well in presenting your presentation on today's theme. Thank you very much. And also sincere apologies should there be any shortcomings throughout today's event. So we hope that today's event have been very beneficial to all participants. Definitely lots of good learning from various workplaces in Brunei Darussalam, and Sheena will always look forward to working closely with you to improve safety and health awareness within your organization. So let's work together to ensure Brunei Darussalam is a safe place to work and live. With that, stay safe and happy fasting to all Muslim college. Wabillahi taufiq wa hidayah. Wassalamualaikum warahmatullahi wabarakatuh. And we end this today's session with Surah Al-Asr. Bismillahirrahmanirrahim.